3. The gut-brain connection is real, but also complex. So let's talk about something that comes up a lot in autism parenting circles: leaky gut. Now, leaky gut sounds dramatic, like your child's insides are falling apart, but what it really refers to is something called intestinal permeability. That just means the lining of the gut isn't doing a great job keeping things where they belong. Our intestines are supposed to act like a coffee filter, letting nutrients through, but keeping toxins, bacteria, and undigested food out of the bloodstream. But in some people, including some people with autism, that filter might get a little porous. When that happens, it can lead to inflammation and all kinds of symptoms: stomach pain, diarrhea, behavioral changes, and even skin issues. Here's the tricky part: the gut and the brain talk to each other a lot. Scientists call this the gut brain axis, and it's a two-way street. So when the gut is inflamed or out of balance, it can sometimes affect things like mood, anxiety, focus, or sleep. That's why some researchers believe there may be a connection between gut health and certain autism symptoms. But here's the important thing: this doesn't mean poor gut health causes autism. That idea is outdated and not supported by current science. Autism is primarily genetic. What we are seeing, though, is that many autistic kids have feeding challenges like RFID, avoidant restrictive food intake disorder. Kids with RFID often have very limited diets like white foods, dry textures, same few meals over and over. And when that happens, the gut can miss out on the nutrients and fiber it needs to stay healthy. This creates a cycle. Autism symptoms make eating hard, limited diet affects gut bacteria, poor gut health adds stress to the body, more stress can make behavior worse. This is what researchers call a self-reinforcing loop, and it's one of the most convincing arguments I've found for why we should care about gut health in autistic kids. Not because it's a cure, but because it can impact the quality of life. Studies show that kids with autism and RFID often have fewer helpful gut bacteria, like bifidobacterium. They may have more inflammatory bacteria, like Enterobacteriaceae. And this imbalance is called gut dysbiosis. It can increase anxiety and irritability and digestive issues. Some probiotics, especially multi-strain types, have shown promise in gently improving that balance. But again, it's not about fixing autism, it's about giving the gut the support it needs so the rest of the body and brain can function a little more smoothly. So, where does that leave us parents? We're not trying to chase miracle cures.